Hello, this is Dr. Ken Muich, Fibromyalgia Wellness Center. Welcome, everyone, and I look forward to visiting with you today concerning my revised, second edition revised book on fibromyalgia falsehoods, fakers, and facts. I received a test copy this weekend, which I went over, and so they should be available on the market relatively soon, hopefully within the next couple of weeks. And so what I thought I would do is cover with you the new material that's in the book, which I think is very, very important. I like to update things on a semi-regular basis anyway, but this is the second revision. The first one I think we actually had in 2014. That was the original book. So we're very, very excited about this. So we're going to be talking about a couple of different subjects. The first one is in the book, I have a chapter called Take It Slow. It's very, very important, I think, because if you're a fibromyalgia patient, you know that you're not doing a lot of exercise. You're not running marathons. You're not lifting heavy weights. If you are, I'll be extremely surprised because no patient I've ever had come in is on a heavy-duty exercise program. And so because of the fatigue factor and the pain they're actually going through. Now, research comes out every once in a while that I wonder where they're getting this research, but research actually states that the fibromyalgia patients would do well if they do heavy exercise and weightlifting and a lot of running and so forth, cardiovascular. If my patients actually did that, which they're not able to do, I probably wouldn't see them for a week or two because it would exacerbate their existing conditions. Your body is not actually set up to do exercises because of the pain level that you're in. So we place the patients on our protocol, and they do have days in which they feel great during the protocol. And all of a sudden, from the time you had heavy, say, fatigue and pain symptoms, that you have a great day, patients like to go out and do everything and catch up to everything that they were not able to do, whether it be clean the house, paint the Sistine Chapel, build a garage, whatever it might be. And then they come in and they say, well, my fibromyalgia is worse, and I'm wondering whether or not the protocol is working. And I'll ask them what they did. Some patients come in and they'll say, well, I went skiing, I cleaned the whole house, I cleaned out the garage, I moved furniture. Well, this is actually what's happening. Your body is not acclimated to that. We're going to get to that in just a few moments. What actually is occurring. After the patient has gone through our protocol, then they want to all of a sudden do everything that they were never able to do before again. And they come back with pain. And I have to explain to them, which I've explained during the treatment, explain to them again that the reason why you're feeling the way you are is not because of fibromyalgia once the protocol is completed. It's because your body, your soft tissue, your muscles, tendons, and ligaments are not acclimated to the use that you're putting it through. For some of you, it might be years. And so if you have not exercised, have not done any heavy work and so forth for any period of time, your body is not able to cope with what you're putting it through. We have found, Dr. St. Amand and myself and research has found that it might take anywhere from 6 months to a year for you to get reacclimated, your body to get acclimated to the pressures that you're going to place it under that you want to do. You want to do all these new things. You want to really get excited and build that garage or go on those trips and so forth. So that's why I have to take it slow and easy. During our protocol, we do give patients, as they improve, various exercises. Now, if you're a couch potato or if you're an Olympic athlete, which I work with both, the idea is you stretch before you strengthen. Stretch before you strengthen, especially if you've had an injury. And heat is not good unless you have an osteoarthritic condition. On a new injury, cold is important, not directly on your skin, inside of a light cloth, about 15 minutes on, half hour off, again, not directly on your skin. You can do that repetitiously, and that should really help. But the bottom line is, don't overdo it, because you will injure tissues that are not acclimated to what you want to put them through. And so that's very, very important. Another item that we have in the book that's relatively new is, excuse me, why fibromyalgia patients read books like Dr. St. Aman's and mine and various other ones, and all of a sudden they consider it to be a self-help or self-do book. Believe me when I say it is not. We've given you a lot of information in the book, but what you need is an individual, a health professional that has been trained in our protocol to help you through this. That's why I'm going around training doctors, health professionals to use this protocol properly because of your number of conditions, the inflammatory response, the mapping that needs to be done for trained individuals to do over you, the 18 specific points, which is not the total amount of diagnosis, but is very, very important as far as using the 18 points of tenderness to show you that you're improving. That's very, very important. You know, patients come in, they have 16 out of 18 points. Most of them are acute or moderate, and all of a sudden they start going down. All of a sudden they have 12 points, they have 11 points, they have 8 points, and the acute is gone, and even the moderate disappears, and most of the points that we have, they're testing, are mild. Those are all improvements, and you, as a fibromyalgia patient, needs to know that you are improving. It's very, very important for you. So, again, just because you read a book, don't try and do it yourself. Well, another thing is the amount of guaifenesin to take in our protocol. You can't do that. You just can't be doubling it. Everybody has a little bit different avenue as far as for treatment and correction is concerned. And you want to make sure that you are using someone that is actually trained in the protocol. That way you will have a great deal of success. Now, the third point is why fibromyalgia patients fail, regardless if it's our program or somebody else's program that they use. Keep in mind, ours is the only one that we know of that actually treats the condition, not just the symptoms. So there's a lot of points that we've seen with patients that come in that actually fail. One of them is the differentiation of symptoms from the conditions. There's a lot of conditions. I believe I mentioned there's anywhere from 13, if you stretch it, to maybe 15 different conditions, which I've covered recently. Everything from rheumatoid to osteo to MS to lupus to Lyme's, a variety of different conditions. And a lot of the symptoms have similarities between that and fibromyalgia. So we want to make sure that you understand that we're taking care of the fibromyalgia. Now, as the fibromyalgia symptoms go down, so also will a number of your other symptoms. But that doesn't mean that we are reversing the rheumatoid arthritis or the osteoarthritis or the MS and so forth. No, you still have those. They're made worse by fibromyalgia, but the point is that we are taking care of the fibromyalgia that is maximizing the pain levels and discomfort that you're having in all the other things. Another thing is frustration about these other conditions, and that is that, again, the protocol that we have is for fibromyalgia, but it also helps all the other conditions that you have. And as the symptoms alleviate from fibromyalgia, remember, they cross over to these other conditions, and so you should have another improvement, so to speak. Another one is medications. You know, sometimes I wonder if doctors, and I'm sorry to say this, really, doctors really have a difficult time understanding fibromyalgia. I'm getting more and more referrals from MDs and DOs that really not only don't they have a difficult time dealing with fibromyalgia patients because they come in with so many different symptoms and they vary, and they don't have an answer. I mean, and so rather than just shooting opiates at people, as I mentioned to you, I've had patients come in with opiate medications, also with medications on conditions they don't even have, high blood pressure and cancer and so forth. It's almost like a dartboard. They're trying to throw things at patients and see if it'll help, and it's very, very frustrating. Another thing that is a problematic area for fibromyalgia patients that cause them to actually fail is seasonal changes. Look, in Arizona, just a couple of days ago, we had 75-degree temperature. Yesterday, it was, I think, 107 or 108. Now, if we were dinosaurs, we'd be dead, to be honest with you. Well, for fibromyalgia patients, when you have dramatic changes in temperature, whether it be hot, cold, whether it be rain, dry, moist, so forth and so on. That adversely affects fibromyalgia patients. It causes them to have a lot of additional pain and so forth, almost like an osteoarthritic condition. A lot of people in the Midwest, because of the humidity and so forth, they're stiffer, achier, sore, so forth. Well, magnify that. That's what happens with fibromyalgia patients. So that's a real problem. Now, another thing. If you plan on doing, again, this goes back to the self-help, self-do book, you need to have someone to do mapping on you. It's very difficult for you to do mapping on yourself, especially if you don't understand it. Fibromyalgia produces a lot of fluid and lumps and bumps underneath your skin, and we actually make note of those as we check you. As you improve, so also will these disappear. But you have to have someone, again, that is properly trained in actually doing mapping on the individual itself. The 18 tender points, that's another thing I just mentioned. The 18 tender points is not the definitive form of diagnosis for fibromyalgia patients. However, it is very, very important for fibromyalgia patients to know they're improving, just like mapping. You improve, and as the acute conditions, as the acute tender spots disappear, they not only go down as far as the amount of pain, but also they go down as far as the number and so forth. And so you have a very, very wonderful, appreciative response. So you know they're going down. If you started out with 16 or 18 points, of which most were, hello, Shelley, most of them were acute. Now you may have only 10, and most of them either moderate or mild. That's important. You have to understand that you're really getting better. You're improving. Fibromyalgia patients need to see this. They need to know that they're improving. This is one of the wonderful ways that we actually use for that. Let's see, I think we've covered most of these things. The other thing is that fibromyalgia patients on our protocol need to understand they need to follow the protocol. If you deviate, you will fail. If all of a sudden you start getting creative and not communicating with the doctor, letting them know what you're taking, what you added, so forth and so on, then you will fail. And that's what happens with a lot of patients. Even during the pre-protocol where we're detoxing, we give them a specific list. It's not a dietary thing. It's a detox. Okay, there's a lot of foods on it. We're just taking away those things that are inflammatory out of your system. The sugar, the gluten, trans fatty acids, dairy, those things that we know are inflammatory, not for 100% of patients like yourself, but most of them are. And so if we remove them out of your diet, and then after a couple of weeks we add them one at a time, we'll find out what kind of response that you have, and that way you know what you should or should not continue to eat, digest, so forth and so on, if you want to get better. But I mean, in the middle of the pre-protocol, people come in. I'm sorry, I got to have my Coca-Cola in the morning, or I got to have my bread, or I have to, I right then and there I know that you're not going to be doing well on this protocol, and we'd rather release you than actually have you fail further down the line, and that's the most important thing. We're here to help you through this, and we believe is a very, very successful protocol if you follow the rules and regulations. It's like a diabetic. I mean, really, if a diabetic doesn't follow rules and regulations, they're going to be sick. They might lose a limb. They might have a stroke, a heart attack, a variety of different horrific things. Whereas in fibromyalgia, you're just going to be achy, stiff, sore, and painful if you don't follow this. And we know that has been very, very successful since we've been doing this for decades, and it is dealing with the condition itself. Now listen, this is number 16 that I've given as far as live videos. If you have not seen some of them, you can go to my website and you can actually check them out. We're actually putting each and every one of them sort of like in a library for you, so you can just go check and run through each and every one of them. And that makes it a very, very successful venture for you. You don't have to see them all at once. You don't have to binge. You can look at them a little at a time. I try not to do any for too lengthy period of time, about 15 minutes, and that's about where I'm at right now. But you can check that, and we'll keep you in touch with the different presentation talks and so forth. I'm going to be contacting the meetup groups for fibromyalgia, or if you know of some, I'd love to have the opportunity to come and talk to your group. Please give us a ring or a contact, and we will do everything we can to set up an appointment that is efficient for us to do that with. Thank you so very, very much. Have a wonderful week. I'll let you know also when the book will be available, and so that way you can check up on the latest information. Thank you, thank you, thank you, and have a wonderful week. And I look forward to any questions that you may have, whether you send them to me directly or during the video presentation itself. Have a great, again, week. And if you're in the Arizona heat, hydrate. Make sure you drink water. Try to stay off of the sugar drinks. Check the labels. What does it have in it? What is the sugar content, the salt content? You know what I usually do is if I need something, well, electrolytes, I usually do 3 to 1, 3 parts water to 1 part of the electrolyte drink, and that way you're still getting it, but you're not actually putting your body under duress by taking too much in at one time. Thank you again, Shelley. Thank you for attending. And everybody can come on and ask questions. Sometimes I think I might just have a 3-minute presentation and the rest of the time Q&A. Thank you. Have a great day. Look forward to helping each and every one of you, and best wishes. Bye-bye now.